Are you living with HIV/AIDS or with a chronic disease and wishing to immigrate to Canada? Do you have a Canadian citizen as your spouse or as your sibling or relative and looking at the possibilities of migrating to Canada but needed to find out whether that can be possible? Well, you can still migrate to Canada, depending on the level or nature of the illness. Many people in the past with similar illnesses have immigrated to Canada, and what makes you think you can't also achieve the same dream? When migrating to Canada, you will have to go through Canada Immigration Medical Exam. This examination can consider whether a person can be deemed to be clinically admissible to Canada. In case a person is having some serious medical or health condition that may require excessive demand on public health service, they might be denied entry to Canada. So, the question of whether a person living with HIV can migrate successfully to Canada typically depends on the type of immigration application that person put in for. Canada Immigration Medical Inadmissibility due to positive HIV status. In Canada's immigration process, the medical examination is mainly to confirm whether you are medically admissible or inadmissible to immigrate to Canada. It also serves as evidence if you pose any threat to Canada's public health and safety, or if you have any health condition that is likely to debilitate Canada's healthcare system. Your application for Canada's immigration might be refused if your current health status seems dangerous to Canada's public health and safety. Additionally, medical inadmissibility also occurs when your health condition can result in exuberant demand in Canada's health or social services. However, foreign nationals who are aged above 15 years and want to apply for Canada's immigration are mandated to undergo a medical examination. HIV-positive foreign nationals in the family and dependent refugee classes are not always regarded as medically inadmissible because of the extremely high demand on Canada's healthcare system. Steps for HIV immigration to Canada. Here are the steps involved for HIV-positive applicants who intend to immigrate to Canada. 1. Post-test counseling by a panel physician. 2. Identification of the HIV-positive foreign national. 3. In-person interview with a visa or immigration officer. 4. Processes after the in-person interview. 5. Outcomes after 60 days of the interview. 6. Formal notification to the spouse. How can a person living with HIV immigrate to Canada? These are the several ways someone living with HIV can immigrate to Canada. Applying for permanent residency. Applicants living with HIV who are applying for permanent residency may be qualified on grounds of having a Canadian citizen or permanent resident as spouse or relatives. But applicants above the age of 15 years will be required to pass through a Canada Immigration Medical Exam. If the examination turns out to be positive, this can make permanent immigration difficult. HIV patients' application for Canada permanent residence can get refused on 3 conditions. These conditions are: 1. If the health condition of that person is considered a danger to public health. 2. If it is considered to be a danger to public safety. 3. If the patient's health might require excessive demand for Canada's health or social services. But the excessive demand may not be considered if the applicant applies as a refugee or is being sponsored by a Canadian citizen or permanent resident. Thanks for watching. If you need more information, then head onto www.workstudyvisa.com. You will also find a link to the full resource attached to the description. Ensure you subscribe for more updates.